Hello, I'm Daniel with Recovery Central here in Washington, Indiana on this September morning of 2021. And we're talking about um, economics of recovery. I am not an economist. I just know there is no way to explain the alcohol and drug problem without looking at economics. We need to be aware of the impact of substance use disorders on healthcare, transportation, uh, business, productivity, the courts, law enforcement, and other social structure, which has been estimated at approaching $1 trillion a year um, annually. So it is it is something that we have to understand as we look at this problem as a whole. We can also speak in terms of supply and demand and look back at the history of substance use in this country. We can go back about 100 years to Prohibition, the 1920s. And Prohibition was an attempt to control the supply of alcohol by making it illegal, by seizing it and arresting those who made and sold it. And this was also a battle that raged until the um, the end of Prohibition, which was the 21st Amendment in 1933. There are some historians who blame Prohibition for the gangster culture that emerged in the 20s. We can also look forward to the 1930s, where we see the rise of AA and what you might call a demand reduction approach. Not so much supply control, but we're now talking in recovery meetings about the demand for alcohol, why people drink excessively. How do we curb that demand? How do we better manage our lives from the effects that alcohol might have on us? So we have shifted now in the 1930s away from a supply control approach to more of a demand reduction approach with alcohol. And not that the government had the entire thing planned out that way, but this is what actually happened in American history. By the 1970s, we could look back on several decades of energy feeding into efforts with prevention, education, treatment, recovery support, and really a development with advocacy and public policies that brought us to a point by the 1970s where we had potentially a vision for recovery in America. We're talking about a foundation for an effective demand reduction approach, looking at collaboration between agencies with organization at the federal, state, and local levels, and a functioning network to facilitate prevention, education, and treatment and recovery support throughout this country for anyone who needed help with a substance use problem. And then the 1980s brought a sweeping change to all that because of new enthusiasm and passion to rid society of this entire menace of illegal drugs and all the problems that go with it. And so the war on drugs became a supply approach, controlling the supply of drugs, and it escalated incarceration, interception of drug shipments, and other police and military actions with the intention of ending the illegal drug industry. We now realize it did not work. By the 1990s, I was personally involved as a member of the Indiana National Guard in working with something called a drug demand reduction program, which allowed me to become familiar with the Indiana Commission for a Drug-Free Indiana and to become more aware of other agencies who shared interests along with the Indiana National Guard, where we could actually begin working together in educating our local community. And it shows that by the 1990s, the government still understood that we needed a demand reduction approach, not just supply control. And so it may seem at this point that I am bashing the whole idea of a supply control approach to our substance use problem. And with that in mind, I want to consider a statement from the UN about supply and demand. And according to the UN, when it comes to the drug problems globally, the UN is telling us that the most effective way of tackling the drug problem involves a comprehensive, balanced, and coordinated approach that addresses both supply control and demand reduction, which reinforce each other together with the appropriate application of the principle of shared responsibility. And I do not find anything wrong with this statement. What I would actually say is that there probably is a need for a balanced approach, that we are dealing with both supply and demand when it comes to our substance use problems. The question I have is about our rural communities. Is there really a balance with supply and demand in our rural communities when it comes to this substance use issue? Or do we happen to see a little bit more in the way of supply and not so much demand? Or that we are primarily law enforcement and legal system and not a lot of recovery community where we would actually have a more demand reduction approach? And so does the typical rural county have this problem with a supply-sided approach to substance use? And if so, that would really make sense for us as we look at the new effort that is underway in Daviess County today, which is to address more of a demand reduction program. And so in light of all this, I would suggest we understand that the new consortium in Daviess County, which includes Real Recovery, Recovery Central, we're also respecting the recovery meetings that have been already underway, because they are an important demand reduction approach to our substance use problems. And it is a time when we need to have new discussion about why people are using illegal drugs or using excessively. Now, what has been happening over the last few years, really, is a lot of new thinking across our country. We seem to have a lot more people who now know somebody who has struggled with substance use, and we don't always perceive these people as criminals as they had been treated before. And so I have used the 6-minute video clip of Governor Chris Christie in his 2015 presidential campaign when he talked about a friend, a personal friend of his who had been prescribed a painkiller on which he became addicted. And that addiction to opioids destroyed every aspect of this friend's life. And that emotional appeal by Chris Christie did capture a lot of attention. My own perspective did not include Chris Christie as the candidate that I favored, but I say that to point out that it really caught my attention as a higher priority than political opinion. And what happened after Chris Christie made that statement in 2015, less than a year later, the US Surgeon General published his landmark report that called for a new way of looking at our alcohol and drug problems. The Surgeon General's office under Obama was actually followed up with the Surgeon General in the Trump era, working very much with the same document, Facing Addiction in America. And so the report calls us, in a nutshell, to integrate mental health and addiction services into mainstream healthcare because we cannot afford to do otherwise. So our current efforts really call us to a new opportunity to see parents who have been incarcerated, who need to be reunited with their children. We need to end the stigma against substance use and mental health. And it really calls for us to listen to people's stories, to adopt new priorities in our society, and also embrace the new national approach and face the reality that we see at home right here in Daviess County. So in terms of economics, we must further understand the rural economics of substance use problems. We know that our rural communities they find services that are limited, but also in a wider geographic area compared to the urban and suburban areas. The close-knit nature of rural communities brings challenges related to the confidentiality, the privacy, and the stigmatizing of substance use. And then the substance use disorder treatment system is very complex, and it can be difficult to navigate, especially in rural communities. We can also speak of barriers, a list of barriers in our rural community. You might call them barriers to recovery. I will not elaborate on these, but you can see them on the screen. And not only should we understand these barriers, and we'll be hearing more about these in the months ahead, we also need to understand something about the lack of data for addressing rural substance use problems. And this is a statement from the National Institute of Health, and it tells us that while the use of illicit drugs affects every region of the US, most of our information about drug use comes from large urban areas. And this is true despite 2 decades of increasingly visible rural drug use and its related harms. The statement came out in 2016 with a little bit of research along with that. So what's happening is we really have not been prepared for the rural substance use crisis we are facing today. And it makes sense that the Health and Human Services Administration, or Health and Human Resources Administration, is giving Daviess County $1 million over the next 4 years to have a better response to our local drug problem. And this is going to be quite a challenge. We can understand that we are one of many rural counties that really would not have seen this coming. And so it is important for us to recognize the opportunity we have, not just with the dollars, but also to recognize the need and what more of us could actually do to help make this situation better. So we can talk about the economics of rural solutions. And I apologize for moving too fast, but we are talking about a continuum of care that includes screening, diagnosis, assessment, active treatment, and continuing engagement with recovery during treatment, and with services that address all aspects of a person's life, including challenges that might make the substance use problem worse or prevent recovery. And so we have to have a comprehensive treatment approach here in our rural location. We also need relevant services, along with clinical case management, housing and transportation assistance, mental health, and trauma-informed services. When it comes to trauma-informed services, we're talking about service that understands the impact of trauma, which is often the beginning of addiction for a lot of people. A lot of addictions begin with something traumatizing. We also need to recognize the signs and symptoms of trauma in the patient as well as in friends and family members. We also need to integrate that knowledge of trauma into treatment systems and practices. So we might have a trauma-informed community, a trauma-informed service. And we want to prevent people from being traumatized all over again. We also need family engagement in therapy and behavioral therapy, vocational and educational services, and all that goes along with that. And this is just an introduction, but we need a comprehensive treatment process where people can quickly access the services when they need. And we need to make those services much more available to our rural population. And this is the challenge we are facing today. While there's a lot to be said about economics, and I have tried to give you a bird's eye view of the need for funding, we also need to understand that some things cannot be accomplished with money. And this is what we're facing here in Daviess County. We ought to know that money does not give us motivation that would have been inspired by a person's own life experiences. Money cannot really give us the values that are in us when we perform these services, the values that drive our provision of services. The money does not really give us a determination to see that justice is served. The money cannot create true friendships, nor can the money provide the power of people working together with common convictions, sharing their burdens with each other to really work out a best solution that is really their community solution with a commitment to serving the greater good. We really don't get any of these things from dollars, and yet these are very fundamental to addressing the substance use crisis that we are seeing today. I would point out this tendency that we as human beings have to leave the store in the hands of somebody who seems good at maintaining control. We recognize the need for order in our community, and yet control is not the same thing as leadership. Being good at controlling things does not mean that we have any real visionary solutions. And so we really need people who know the hunger for real solutions because of the experiences they have known from their own lives. We may not be able to get around the need for funding. That is essential. We just need to remember that no amount of money can provide real answers without the right people who possess the right passions and the energy to hammer out the right solutions. We really need people like you to decide for Daviess County to call this the right time for a local change that really needs to be a sweeping change. We need people who have had enough of the overdose deaths, enough of the broken families, the broken neighborhoods, the broken communities, the broken hearts. People who have had enough of that, who really want to see a change. And we need your help here in Daviess County to bring something new into our community, something dollars simply cannot buy.